Hello, my name is Dr. Randall Brown, and I'm a professor in the Department of Family Medicine Community Health. I'm the director of the PROTEA lab, the program for research, outreach, therapeutics, and education in the addictions. While I've been at UW for 22 years, the lab has started growing and really came about as an entity about 8 years ago as we were expanding faculty and staff to address issues related to substance use. And we do that through clinical patient care, health professional education, and a program of research. We take care of patients in primary care settings and in the hospital and in collaboration with other specialists such as hepatology and infectious diseases, where we see patients who are either currently struggling with addiction or a use disorder and try to work with them to put plans in place to improve their health and well-being. We also address substance-related issues in the context of caring for those patients, with common examples being hepatitis C or common mental health conditions that frequently accompany substance use disorders. In the context of our educational programming, I'm the director of UW's Addiction Medicine Fellowship Program, which is a very key part of innovating healthcare to better address substance-related issues in the population at large. It's very important that we have health professionals that are well-versed in the harms attributable to different patterns of use of alcohol and drugs, and be able to speak with patients about those issues, direct them to preventive measures to help ensure their ongoing health and well-being, and connect them to definitive care when the time comes that they wish to engage in significant behavior change or move toward recovery and even abstinence. Also, in the context of our educational programs, equally important is making contact with learners early and exposing them to content around caring for patients with substance-related issues. So in the course of our fellowship program, we welcome residents in family medicine, internal medicine, and other PA students and medical students to get them exposure to working with those issues and collaborating with patients on them. In the context of our research programs, we look primarily at investigations coming from two angles to address substance-related issues. One comes at it from a health systems level, where we seek to improve and enhance services that target substance-related issues, specifically in general medical settings and community-based settings. So for example, primary care, general hospital settings. We also collaborate with syringe service programs and implement things such as mobile health interventions to improve rates of recovery or improve ongoing health and well-being for people who are continuing to use. We also innovate in terms of research and exploring the ways the health system might modify itself to prevent, say, substance experimentation or substance use from progressing to addiction or a use disorder. We're doing that specifically these days in populations of individuals who are admitted for a traumatic injury, and looking at care coordination models and behavioral care that will reduce the likelihood that they would misuse their opioids or develop addiction to those substances. And those are a couple examples of our health services program. We're also at the cutting edge of research around the therapeutic application of psychedelic compounds in the setting of addiction and common mental health issues that might accompany or even lead to those. And we work with compounds such as psilocybin, MDMA, and 5-MeO-DMT in scientifically rigorous studies looking to determine safety, feasibility of their use, models for implementing them, as well as their clinical effectiveness. Thanks for taking the time to learn more about the PROTEA program and what we are doing to innovate and improve care for all.